You're watching NorthState Health, the North State's first local health program.
Well, let's talk about now spinal stenosis, in case people haven't heard of that before. What is it? What are some of the symptoms? Let's talk about
Sure.
that.
Spinal stenosis is just a narrowing of the actual spinal canal where there's pressure upon the nerves that go to the leg. You can get leg pain, which is commonly called sciatica, and often what this develops is an inability to walk distance. They have a shuffling gait, often leaning forward, and they are unstable on their feet, and often are using gauges of how far one can walk based upon their leg pain. And the shorter distance they can walk, the more likely that the stenosis is a severe amount. In the end stages of that stenosis, they can develop weakness in their legs. They can also develop numbness, as well as in severe conditions, loss of both bowel and bladder control. Okay. And those are actual surgical emergencies at that point.
Okay. Now let's say somebody does have, these type of back problems. They need to come in and they're going to get some help. I think you can walk us through some of the procedures that you do, the treatments for this.
Sure. And I think the slides that we're going to see here shortly are some of the minimally invasive procedures that we do. And again, these are incisions that are done through 1-inch incisions, and we can actually do a complete decompression for a disc herniation. This is actually a tube-based system, so we don't cut any muscles. We actually use a microscope during the procedure. And on the left is essentially what you see when you first place the tube into the spine, and on the right-hand side of the screen is when we get down to the bone and the bony decompression to actually enter into the spinal canal. I think if we go to the next slide, this is again on the right-hand side an artist's depiction of what we actually see. In the blue, pushing the purple, is essentially a disc herniation, and we can actually remove that, and it takes about 45 minutes to do the procedure, and these are actually done as outpatient procedures where patients are able to go home the same day of surgery.
Oh, that's great.
We can do larger procedures such as fusions, and this is where, again, the radiographs or the x-rays on the right-hand side show some of the spinal hardware that we're able to implant through incisions either 1.5 inches in size, or in some cases 1/4 inch. And so again, these are major procedures that used to require multiple stay days in the hospital, where now patients are going home the next day, or in some cases the same day of surgery.
And definitely patients want to hear that.
You're watching NorthState Health, the North State's first local health program.